Hey, what's up, guys? I'm David Hinden. I am a trauma surgeon, and today we're going to react to more videos by the amazing Dr. Glaucomflecken. Let's go.
Hello?
Good morning. This is United Healthcare. What are you doing?
I just got done at the pharmacy.
I know. That's why I'm calling.
What? How did you...
Did you know United Healthcare has a mail order pharmacy called Optum RX?
Beyond the whole dynamic of insurance companies often saying no and then the doctors having to sort of beg to get medicines approved for patients that should be approved, there's this whole weird dynamic with insurance companies wanting you to use their own specialty pharmacy for the medicines so that they can make even more money from the medicines once they approve them.
No.
Oh, well, we'd like you to use that from now on.
But I like my pharmacy. I've been going there for years.
Well, it's time to stop and use our pharmacy instead.
Do I have a choice?
Oh, sure. We can't legally make you use our mail order pharmacy. We'll just make you pay more.
What?
You can go to your precious little
These are almost not funny because they are so spot on. This is so true.
community pharmacy, but your copay will be much higher.
Well, then you're basically forcing me to use your pharmacy.
Oh, we don't use the word forced. More like financial coercion.
Oh, there.
I'll stick with my current pharmacy. Thank you.
Oh, my God.
Hello? United Healthcare again. You know, with Optum RX, your medications almost always come on time and are frequently the correct ones. I've never had any problems with my pharmacy, and it's only a mile down the road. But it's not owned by United Healthcare. Therefore, it's terrible. Okay, please don't call me again. Goodbye.
The anger.
You need to use Optum RX. What are you doing at my home? It's convenient, and we own it. I told you I'm not interested. You have to. It's the best. Okay, what happens if I'm not home and the medications are sitting on my porch in 90-degree heat? Well, they'll be ruined, of course, but just call customer service. Okay, how's your customer service? Awful. All right, thank you. Goodbye. Wait. Just give me money. You want money? Yeah, I'm United Healthcare. I need money. Can I just look at some money? You know what? If it gets you to go away, here, look, $20. See it? Can I smell it? Okay, get out of here.
Oh my God. I love how he roasts healthcare insurance companies. It's so good. All right, let's watch another one.
This is surgery. I was paged. Jim Bob, you need a hip replacement. I don't care how much scrap metal you have in your barn. You need to go to the hospital. You need to see an orthopedic surgeon. Hey, I'm really sorry about that. I was paged.
I love the kind of like arrogant, vaguely annoyed, I was paged. It's great. You can totally hear certain people doing this, and he's just spot on with the tone. I love it.
Yeah, I got an 80-year-old with acute cholecystitis. He was having biliary colic episodes back in July. Now he's got a fever, leukocytosis. I need to transfer him to the university for surgery.
This is actually pretty accurate. This is kind of the report that an ER doc might share over the phone with a surgeon about a patient who has an infected gallbladder.
Why didn't he get surgery back in July? During corn detasseling season?
So I will just say that this kind of running joke about the farmer being really tough and kind of gritting their teeth, it really happens with some patients. So it can happen with farmers, and often our veteran population historically really kind of puts up with a lot of pain, and sometimes to the detriment of their own health. Well, they'll sort of ignore pain for a while before they come to a healthcare setting.
God himself couldn't make this guy have surgery back in July. You don't have a surgeon out there, and where are you? We don't have a name for it. It's unincorporated land. Hey, Tom. Yeah, boss. Were you able to get a hold of that general surgeon down in Brookfield? Oh, yeah. No, he only operates on horses now. Oh, man.
That is a thing. Almost everyone knows a story of a general surgeon who has been called by the local zoo to operate on, say, a gorilla. It's pretty rare, but it happens. I knew a surgeon in my training and now a surgeon where I live and practice who was called to the hospital to help with that.
No, we don't have anybody. All right, can you send over some chart notes? Oh, sure. Hey, Peggy, Fire up the fax machine. Just send it electronically. Epic has interoperability with most systems. We'll interface through PACS and you can push everything through the health portal.
All right, double joke, that sounds super nerdy, and even in hospitals that all have Epic, it's not always so easy to communicate from one hospital's Epic to another. It's painful.
Hey, Peggy, you got the fax going yet? Hey, boss, Darlene is here. She's going into labor. Yeah, okay, give me a second. She says she doesn't want to be a bother. Tell her I'll be there in 2 minutes. All right, just tell me what you saw on the ultrasound. Oh, we don't have one of those.
Oh, no.
You don't have an ultrasound.
Nah, we sold it to help pay for a CT scanner. Okay, well, what did the CT scan show? Not much. We ran out of contrast. You don't have any contrast? Well, Texaco Mike is cooking up a batch, but it's gonna be a while. It's not something you want to rush.
In the days before we had ultrasound and before we had CAT scan, it is possible to diagnose cholecystitis from labs, from clinical history, and from a patient's exam. But nowadays, certainly in the United States, typical care involves an ultrasound or CAT scan for some form of imaging during the diagnosis.
So you want to send a patient 200 miles for surgery without any imaging? Yes, that's right. Outside hospitals. It's always the same with you guys. Huh. You're not happy with the level of care we have out here in the rural community?
This is a tough dynamic, right? For the receiving doctor, there can be this feeling that a patient hasn't gotten the care that you feel they should get. But in reality, clinicians operating in rural settings don't always have the resources that we have at academic centers. Really, when someone calls to try to transfer a patient to an academic center, it's really because the doctor on the other end of the line is trying to get care for that patient that in their environment they may not be able to provide.
No, it's substandard. Hey, let me ask you, how many partners do you have? I have 7 partners. Why do you ask? Oh, well, maybe instead of being the 8th surgeon at a quaternary care medical center, you can come out here and help us.
Totally fair.
That's what I thought. So me, Texaco Mike, and the gang will continue doing our jobs to the best of our ability with the resources we have, and you can help us when we need it. Yeah, okay. Hey, boss, Darlene says never mind. It's her 5th kid. She said she'll just do it herself. What?
Time for the next one.
Hey, Bill. Yeah, boss. The pneumatic tube system isn't working. I need you to run this specimen down to the lab.
I think Bill is the med student, if I'm remembering my characters correctly, just for reference.
Lab? Where's that? It's down there. Somewhere. Wait, what, like the basement? Beyond the basement. Take the stairs down further than you've ever been before. When you think you've reached the bottom, keep going.
It's totally true. Like many of the hospitals I've worked in over the years, I don't know where the lab was. If I went back to that hospital and you asked me to run down to the lab to grab something, I would have no idea how to get there. There is definitely this sense that it's this kind of like other world that's buried in the bowels of the hospital. All right, let's keep going.
Eventually, you'll find yourself in an unfamiliar place full of long, dark, windowless hallways. The only sound you'll hear is that of your beating heart and trembling breath.
Okay.
Well, how will I find it? The lab? It'll find you. Hi.
The couple times in residency where I trained and I actually did know where the lab was, you'd run down there. Usually it's because there's something that's really important to you for the patient. And often you interact with someone who really couldn't care less about what like your important errand is because they're taking care of a zillion patients with a zillion different labs. So I love the eyebrows, this expression. It's perfect.
Is this the lab? Oh. Is that blood? Do you have a specimen? Yeah, here you go.
I'm just going to call it, this specimen is going to be not labeled correctly or not in the correct sticker confirmation, or I'm having flashbacks.
Where's the barcode? I'm sorry? There's no barcode.
Good.
You just handed me anonymous purulence in a test tube. Oh, well, I have the patient's name. The patient is the barcode. What? To us, down here, the patient is a tube. The tube contains data. It is my job to mine the data, a job I cannot do without a 2D barcode.
This is actually no joke. It is a really, really important detail to make sure that the lab data that goes into a patient's chart belongs to that patient. And this doesn't just happen automatically. There have to be like all these protocols and double checks and things in place to make sure that the data stays with the correct patient in the chart. But this just hurts to watch it because I've been in this med student shoes before.
The patient is the barcode. Okay. So you're one of the lab techs down here? I am a molecular technologist, yes. We are the unseen, unheard Fraggles who convert your patient's purulence into numbers on a page that you read during rounds. Do you like it? We have no time to like or dislike. We have DNA to extract. We must procure 4 nanograms of DNA. DNA is data. We mine the data. It is the will of the pathologist that we mine the data. Oh, the pathologist. I like him. Pathologists.
Oh.
Communicating their orders in a language no one is taught but is necessary to survive.
I love that they have a picture of their boss on the wall. It's great.
Scrape 18, micro, streck, buffy coat, 5 hemes. Thy will be done. I don't know, pathologists seem nice. Of course they do, sitting up there in their cushy offices, sipping Swiss Miss, reeking of work-life balance. Well, this seems like an okay place to work. At least it's quiet. Oh yes, it's quiet, except for the roaring fans of the fume hoods, the beeping of the machines, and the incessant din of 2D barcode readers.
It's impossible to really capture the enormity of even like a small hospital's lab with this TikTok. But when you go down there, it feels like this other world. There are like machines that it feels like a football field long. There are different things making noises and beeping. And like he's saying, there are different areas where there are hoods where they may need to have cultures going to help grow out your sample and see what bacteria might be in it.
Okay, do you need anything else from me? No, I got everything. Thanks for stopping by.
That's so good. If you want to see more reaction videos, click over here. And if you want to see some of the other stuff on my channel, check it out right here. I'll see you guys soon.